The setup process will take approximately 2 hours to perform. When the NeuroQuest EEG technologist, also known as a tech, arrives at your home, they will help you choose a place where you will be staying during your study. This is where the camera will be set up and you will spend the majority of your time, which includes sleeping. Many people choose their living rooms. If the patient is a child or someone who will need assistance, a parent, guardian, or caretaker must be present during the setup time. Before your setup, you will go over the patient information packet. This contains very important information which your tech will go through with you. You will begin by sitting in a straight back chair. The tech will need to stand behind you while attaching electrodes. This makes the hookup process go smoothly. The tech will take measurements of your head and make marks with a wax pencil for specific placement of the electrodes. The wax pencil is not permanent and comes off easily. Once your head is marked, your tech will clean each area with an exfoliating gel. This ensures that the electrodes attach well and provide quality results for your test. Following this, your tech will attach up to 24 electrodes to your scalp with medical glue. This is a non-invasive process, and the glue used will come off at the end of the test with a remover that NeuroQuest supplies for you. Once all the electrodes are attached, the tech will check to make sure there is a good connection and that the equipment is running well. Your head will then be wrapped in a loose-fitting gauze to hold the electrodes in place. Most patients report no discomfort. However, your scalp may itch at the electrode sites after a few hours or days. If you experience excessive itching, you can gently place or hold a cold pack to your head. However, make sure this pack does not leak water onto the electrodes and try not to scratch or pull the electrodes. Your head and the electrode wires are wrapped with gauze to prevent interference. This keeps the leads together nicely and helps to produce a high-quality recording for your test. The opposite ends of the electrodes will then be plugged into a lightweight portable recorder, also called a head box. You will wear this in a fanny pack. Young children wear the recorder in a small backpack. The head box records brain waves. A push button will also be attached to your head box. This should always be accessible to you. When you are experiencing any type of event, you or a parent or caregiver must push this button to mark your study. These marks are then evaluated by your doctor when your test is complete. You are given a daily activity diary and push button log in your patient packet. Your tech will go over these forms with you. The interpreting doctor will use these forms to evaluate your study, so it is extremely important that they are filled out entirely and returned with the equipment. If an electrode or electrodes come off or become loose, or if you have any other questions, simply call NeuroQuest's 24-hour tech line at 1-855-516-8324. You will be advised on how to handle any issues, and if necessary, a tech will arrange a visit to assist. The next video describes both the computer and camera, which are recording your movements, and the head box, which is recording your brain waves.